After age 70, 7 signs your brain is lacking oxygen. Do not mistake them for normal aging. Introduction. Have you ever suddenly forgotten what you were about to say? Do you feel lightheaded when you stand up? Does your head spin after walking just a few steps? Or do you sometimes feel like everything around you is slowing down? Many people assume these are just the natural consequences of getting older. But in some cases, these symptoms can be a signal that your brain is not receiving an optimal supply of oxygen or blood. The brain makes up only about 2% of your body weight, yet it consumes about 20% of the oxygen your body uses. If the oxygen supply is interrupted for even a short time, your nerve cells can begin to be affected. After age 70, the cardiovascular system and cerebral blood vessels gradually change over time. If you also have high blood pressure, diabetes, high cholesterol, or heart disease, the risk of your brain functioning inefficiently increases. It is important to remember that not every case of dizziness. These symptoms can be caused by many different factors. However, recognizing abnormal signs early will help you see a doctor at the right time and reduce the risk of serious complications like a stroke or cognitive decline. In today's video, we will explore 7 warning signs that your brain might be sending you. Sign number 1. Frequent dizziness or lightheadedness when you are lying down, you stand up. Everything suddenly goes dark for a few seconds, or you feel like the room is spinning. Many people just stand still for a moment until everything returns to normal. Because it happens so quickly, they often ignore it. One possible cause is a temporary drop in blood pressure when you change positions, which briefly reduces blood. Certain medications for high blood pressure or diuretics can also contribute to this. The concern is not just the feeling of dizziness, it is the risk of falling. Many hip fractures in seniors begin with standing up too quickly. If you frequently feel lightheaded when changing positions, change your habits. Sit up slowly. Wait about 1 minute before standing up. If the symptoms repeat often or get worse, see your sign number 2. Becoming more forgetful and having trouble concentrating. You walk into a room but forget what you intended to do. You read a page in a magazine but cannot remember. You are talking and suddenly lose your train of thought. These are signs that cause a lot of worry for many people. It is true that memory can change with age. But if the condition appears more rapidly than before or clearly affects your daily life, you should not be subjective. The brain needs a constant supply of oxygen and glucose to maintain its function. When blood flow to the brain is affected by vascular disease or other causes, cognitive function can suffer. This does not mean that every instance of memory loss can also be related to a vitamin B12 deficiency, thyroid disorders, depression, medication, side effects, or neurological diseases. Therefore, if your memory changes significantly, talk to your doctor. Many causes can be detected and treated if diagnosed early. Sign number 3. Feeling easily fatigued when thinking or having brain fog. You are not doing heavy physical work. But after reading for just 15 minutes, you feel exhausted. Solving a simple math problem takes much longer than it used to, or you always feel like your mind is not as sharp as it once was. Many people describe it as having a cloud over their head. This is often referred to as brain fog or a state of reduced mental clarity. It is not a disease in itself. Instead, it is a symptom that lack of sleep, anemia, stress, metabolic disorders, or issues affecting normal brain activity. The brain is a massive consumer of energy. If the supply of oxygen or glucose does not meet the demand, the brain's performance may decline. You will find yourself thinking more slowly, reacting more slowly. If this condition lasts for weeks, especially if accompanied by dizziness, memory loss, or weakness in your limbs, do not delay seeing a doctor. Sometimes, very small changes are the first signs of a much larger problem. Sign number 4. Numbness or weakness on one side of the body, even if it only lasts for a few minutes. This is an especially critical sign. It may not just be related to poor blood flow. It could be a warning sign of you are holding a glass of water. Suddenly, your hand feels weak, the glass almost falls. Or you are walking, and one leg suddenly feels heavier than usual. After a few minutes, everything returns to normal. Because the symptoms disappear quickly, many people dismiss them. They think to themselves that they were just sitting in a bad position, but in reality, a TIA is considered by many doctors to be a warning stroke. If the cause is not checked and treated, the risk of a full stroke in the following period can increase. The important thing is this: do not wait to see if the symptoms go away on their own. If you or a loved one suddenly experiences weakness or numbness on one side of the body, a drooping face, difficulty speaking, trouble understanding speech, or sudden loss of vision, in the case of a stroke, time is brain. The sooner treatment begins, the higher the chance of recovery. Sign number 5. Blurred vision or temporary loss of vision. The eyes are the windows that reflect. Some people describe it as one eye suddenly going dark, like a curtain is being pulled down. Others see images become blurry for a few minutes before returning to normal. Some may experience double vision or difficulty focusing on an object in front of them. These manifestations are not always due to an eye disease. In some cases, they may be related to a decrease in blood flow to the retina or the visual processing areas of the brain. Unfortunately, many people just think that if blurred vision occurs suddenly, especially in only one eye, or accompanied by dizziness, weakness, or trouble speaking, go to the hospital right away. Do not drive yourself. Do not wait until the next day. An early evaluation can help detect conditions that require emergency treatment. If the symptoms appear gradually and persist, you should also see an eye specialist and an internal medicine doctor to find the cause. Sign number 6. Difficulty speaking or unusual slurring of words. You know what you want to say, but when you open your mouth, the words do not come out clearly, or the person across from you says that you are hard to understand today. This is a sign that should absolutely not be taken lightly. The areas of the brain responsible for language are very sensitive to a lack of blood. If the blood supply is interrupted, the ability to speak and understand symptoms can include slurring your words, speaking unusually slowly, using the wrong words, not understanding what others are. It could be a sign of a transient ischemic attack. Many severe strokes are preceded by such brief symptoms. Do not miss the opportunity for prevention just because you think everything has returned to normal. Sign number 7. Unusual, intense headaches or a headache that is completely different from before. However, if you are over 70 and experience a very intense, sudden headache, or one that is totally different from any headache you have had before, you must not. This could be a sign of an emergency condition like a stroke or a brain hemorrhage. In this case, getting to the hospital as soon as possible is vital. Even if the headache is not very intense but lasts for several days, and do not just keep taking pain relievers without finding the cause. The brain always sends signals when something is wrong. The important thing is that we must listen. Factors that reduce blood and oxygen flow to the brain after. The brain works constantly 24 hours a day. To maintain that activity, the brain needs a stable blood supply. Many factors can affect this process. The first fact, high blood pressure can damage the walls of the blood vessels over time. The vessels become stiffer and narrower. This increases the risk of stroke and reduces blood flow to the brain. The second factor is atherosclerosis. Cholesterol and plaques can build up inside the arteries. As the vessels narrow, the amount of blood reaching the brain decreases. The third factor is diabetes. High blood sugar over a long period can damage both large and small blood vessels throughout the body, including those that feed the brain. The fourth factor is atrial fibrillation, or AFib. In people with a fib, a blood clot can form in the heart and then travel to the brain, causing a stroke. This is a very common cause in the elderly. The fifth factor is smoking. The toxins in cigarettes damage blood vessel walls, promote atherosclerosis, and increase the risk of blood clots. The sixth factor is a lack of physical activity. Sitting too much increases. The final factor is not managing underlying health conditions well. Many people see that their blood pressure or blood sugar is stable and decide to stop taking their medication on their own. How to protect your brain after age 70. The good news is that many risk factors can be controlled. The first thing is to manage your blood pressure. Check your blood pressure regularly. Take your medication exactly as prescribed. Do not stop your medication just because you feel fine. Second, control your blood sugar and cholesterol levels. This is the foundation for protecting your vascular system. Third, exercise regularly. Walking, light cycling, Tai Chi, or any exercises suited to your physical condition will help improve circulation and maintain heart health. Fourth, eat a balanced diet. Prioritize green vegetables, appropriate fruits, fish, beans, and whole grains. Limit foods that are too high in salt, sugar, and saturated fats. Fifth, get enough sleep. Quality sleep helps the brain recover and supports memory processes. Sixth, keep your mind active. Read books, play chess, learn a new skill, talk with friends. These activities help stimulate brain function. Finally, do not ignore the warning signs. If you experience weakness, a drooping face, trouble speaking, or sudden vision loss, do not drive yourself to the hospital. Do not wait to see if the symptoms go away on their own. Summary: the brain is the control center for all body activities. Even a brief interruption in blood and oxygen supply can cause serious consequences. Today, we have explored 7 warning signs that may indicate the brain is not getting enough blood or oxygen. Frequent dizziness or lightheadedness. Increased forgetfulness and difficulty concentrating. Brain fog and slow thinking. Numbness or weakness on one side. Blurred vision or temporary vision loss. The most important thing is not to view these signs as just a normal part of getting older. Many cases can be detected and treated early if the person reaches a medical facility in time. Thank you for watching this video until the end. If you found today's content helpful, please share this video with your family and friends, especially those over 60 or 70, so more people can recognize the early warning signs of stroke. Do not forget to like, subscribe to the channel, and turn on the notification bell so you do not miss our next videos on senior health. Note: the content in this video is for informational and health education purposes only and does not replace the advice, diagnosis, or treatment of a doctor. If you or a loved one experience symptoms suspected of a stroke, such as a drooping face, weakness,